Hi, everyone. So this presentation is based on the research that was conducted by the Interdisciplinary Center for Food Security last year in 2020. We studied how the pantries in Missouri responded to the onset of the pandemic. We collected data between July till November. The purpose of the study was just to see the response of the emergency food system. I presented this, I gave a general view of the research for a conference at Agriculture, Food, Human Values Society, their conference, Just Food, which took place in June, in mid of June. So yeah, let's get started. So I titled my presentation, How the Impacts of a Global Pandemic Affected the Food Pantry Operations in Missouri, which is the purpose was to understand the impact of the pandemic and how local pantries were equipped, or what helped them or what didn't help them in responding to the impacts of the COVID-19 virus. So just a bit of detail on the research itself. We conducted 8 focus groups with 20 pantry directors. They were each of them was from a different pantry, both in metro and non-metro areas of Missouri. I should mention that 16 out of these 20 pantries were either directly associated with the church, they were housed in a church building, or they were managed by the church ministry. The other 4 included, one was a pantry within a residential facility, one was an independent pantry. So it was, the religious aspect was there, it was heavily there. So all these pantries are part of the Feeding Missouri Food Network, and that's how we were able to access them. And the data, as I had mentioned earlier, was collected between July and November of 2020. So based on the data and the interviews we had collected, we realized that there were some 10 elements that were very important to analyze the data. There were these 10 points that helped us in understanding the purpose of our study, understanding how the food, how this response was of the pantry. One is the emergency preparedness. So that just means how quick were the pantries in adjusting to the needs of operation after pandemic hit. Were they able to have enough manpower? Were they able to have enough resources to facilitate clients? Secondly, pantry service changes, somewhat of the emergency response, of course, but it also means what were those changes? We are talking about changes, but what are those? We saw a lot of pantries switch to a drive-through model. We saw many implement health and safety regulations with mask enforcement, sanitizing, limiting a number of people inside the pantry. So yeah, and then we have pantry utilization. So interestingly, almost a majority of the directors mentioned that they saw a fluctuation in the number of clients. At some point they would increase, some point they would decrease. They saw many new clients as well. So yeah, that's something of a interesting, all the directors speculated why that would happen. Like maybe they were getting food from some other agency, they were getting help from somewhere else. So yeah. Then, of course, the pantry donations itself, it includes food. During the pandemic, many of the pantries saw new sources of food donation, such as those directly coming from the harvesters or farmers, restaurants, and then, of course, the community members and the government agencies are always there. Donations also include finances and equipment, which the pantry needed, specifically like coolers and fridges for storing the food they were getting. They were overwhelmed. Some of the pantries were just overwhelmed by the amount of donation they received. Then self-care is more specific to the directors, the pantry directors. They're the ones who were running the show. They were the ones who were the main actor in this whole situation. They kept the pantry going. They were managing the volunteers, the food, the supply, the facility, the delivery to the clients. So they were planning all of this. And many of them actually took this position on a voluntary basis. So what was in it for them? And a lot of them mentioned that religion was a big factor in helping them or in making them do this job. But then how did they take care of themselves? Because it is a very stressful situation. Most of them, they had different ways. Somebody said they got into gardening. Somebody said they connected better with their neighbors. Others watched or spent time, others spent more time with their family. So that was just an important element to understand, that if the aspect of self-care. Then of course we also asked them if there were any positives that came out of the situation, and there were. So some directors mentioned there was more of stronger community ties amongst people, more trust in the pantry, more respect for the pantry. Clients and pantries were able to bond better. Pantries realized that they are able to survive, and all the help that the pantries received made them also trust the community and the government agencies. If the government agencies had helped, it developed their bond and the trust for the pantry by the pantry for these other organizations and individuals. Then you have safety practices, which of course, when all this pantry service changes took place, the pantries had to make sure that their operation or their way of operating will be safe as per the COVID-19 regulations, safety regulations. So we saw a lot of pantries switch to drive-through models, which means none of the clients were inside. They eliminated client choice. Some of them still allowed clients to come into the pantry, but it was very limited. Like they would let only one person come, so as to limit the exposure. Then client reaction, of course, because clients were mostly giving very positive reactions. Pantries did see a lot of new clients, but they said mostly clients were very appreciative of what the pantry was doing for them. Most of them liked the drive-through model. There were some cases, very few, where the clients were upset at mask enforcement or not being allowed in the pantry, and they got rude with the pantry staff. But overall, it was a very positive response. Decision-making process, of course, all of this, when the pantry is operating in such a tough time, they have to be making decisions on a daily basis, and and how to implement those decisions, taking ownership of those decisions. So for example, and we will discuss this in detail, just the decision to stay open, or the decision to switch outdoors, or if decision to eliminate or temporarily not give the option for client choice pantry. So those are some of the decisions. There are of course a lot more. Lastly, of course, we did ask the pantry directors what were some of the things that could have gone better, and they still because the pandemic was still ongoing, and it still is ongoing, but they were just talking about what are their needs and concerns moving forward. What are some of the things pantry needed? A lot of it was information on how to access grants, some infrastructure needs, and then some concerns moving forward were just the uncertainty of the situation and the clients. So yeah, a lot of directors showed a lot of concern for the clients, that what would happen once winter comes, how would they do? How would the family survive? Would they be able to pay for their utility bills, and little things like that? So yeah. So yeah, as we mentioned, the decision to continue to stay open, that was a tough one for the pantry. Not all of them though. I guess a lot of pantries said that they knew they were never going to close, but they did close for 2 or 3 weeks to figure out how to change their method of operating. Some pantries, yes, they decided among themselves, would they be able to continue? And these decisions, of course, were dependent on a host of other factors. And then the second big decision the pantries had to take was the need to make the operations safe. So for these two decisions, and of course there were many other decisions, what were the resources that were available to the pantry? So, of course, it's the food itself. Was the food, available? Was there food donation plenty? And many of the pantries, they said they just had way too many pantry donations. They had too many food donations, to the point that they didn't have any place to store the food, which is why we come to ability to store the food. So some pantry would have preferred financial donations, and some even had enough finances or enough money to be able to buy refrigerator or coolers, which also comes down to financial support that the pantry received. even apart from food storage, some pantries used money they had to either invest in or buy a delivery truck or pave the road outside the pantry so it can facilitate the drive-through. Then, of course, manpower to help in pantries was one of the major needs because you need volunteers to help pick food, pack food, and then deliver food, either put it in the car in the driveway, or in some cases, deliver it to the homes of the clients if they're unable to come. I didn't mention here, but of course, resources available would also include knowledge and communication channels with the government agencies, which would have helped Pantry in guiding them a lot. For the food bank was for the most part very communicative with the pantries in telling them how to operate and giving food or like telling them about how to get food. Okay, then one aspect we do come across is social capital. Where social capital is just the community ties and networks that one has or like members of community have with each other. So some of the ones we see here that help the pantry were definitely connection with the churches, with the larger church organization, a lot of space basically before even anything else. Many of the pantries were housed in the church. And because the church service was closed, they were actually able to use some extra room or hallway for storing food. So that, and then the church would also raise money for the pantry, and also church members came and volunteered. So those social capital helped the pantry a lot. Then food banks helped, like the connection with food banks, as I had already mentioned, like in guidance of how to operate safely and providing information about food and what other places or sources were there to get food, and just also being a good source of how would I say, like a guiding source. Not all pantries felt that they had a strong connection or communication with the food bank, but those that did were definitely able to do better. And then this also comes about knowledge about getting grants. So when we were doing the focus interviews, we would see that the pantry directors would often talk to each other, and a lot of them were showing, oh, I didn't know about this. And the other would be like, yeah, you should take my number. We should talk. This is something that can definitely help. And a lot of it was often information about how to access grants or some financial help. Of course, the local community members. So even apart from the church, there were people in the neighborhood who would come and help pantry with through volunteering, or in fact, in some cases, just take the extra food. Even if they were clients, the pantry would just give them extra food and be like, you can just give it to anyone you want. And local community members, yes, it was also include some other churches as well. I should have mentioned that. So if churches were somehow connected to other churches, they also helped in bringing food or helping deliver food or telling about a new set of clients. In one community, police department cops came, and they would take the food and deliver it to elderly population who couldn't drive or who didn't have transportation facilities. So yeah, that was just how the pantry basically was operating, and then how it was working. But then, of course, there are areas of improvement. As I said, there were many cases communication was lacking, other factors were lacking. So what could have gone better? Communication strategies with government agencies, yes. In some cases, the pantry directors complained that the health county or the county health department never contacted them, and they wouldn't know what to do if there was a virus break, or if somebody got exposed to the virus, or if somebody got sick. So a lot of the directors were like, we would just probably close the pantry, isolate the person, work from home. So things they figured out there on their own. But if it would have helped a lot if the health departments were communicating with them. Definitely with harvesters and farmers. So I wouldn't say a new source, but an increased source of food for the pantries was definitely the farmers and harvesters. But there was a big mismatch. So one of the pantry directors we had stated that she was offered hogs by a farmer, and she was like, what am I supposed to do with the hogs? Keep them in my backyard? Which is true. How is she supposed to butcher the hog, or how is the pantry supposed to butcher the hog and process it? And there are reasons for that, because the demand was low from the retail side. Meat processing plants had closed. farmers also didn't really know what to do with their hogs or other livestock. And so this was a bit of a challenge. But then the pantry, there was just a lot of food to give to the pantry, but then there was no way the pantry could have processed that. So maybe in future, like some sort of communication, maybe some help from a government agency who gets involved in like how we could process hogs. And I'm just using the example of hogs because that's what I can think of right now with the example that the director gave. So that, and in general, like there were some pantries had issues storing food, but if they got a lot of fresh produce, they just put it outside on a table so anyone can take it. None of the pantry directors spoke about food being wasted, but they did talk about how overwhelmed they were at times when there was so much food with other pantries. So again, if the pantry directors were communicating with each other during our focus group, I'm sure if they talk to each other, connect with each other, otherwise they will be able to exchange very useful information. Then of course the social capitals, which I've discussed, the stronger the social capitals, the more help the pantry got. And yeah, then the type of donations itself. Now in like I've mentioned, like of course monetary donation was pretty important because pantry just didn't need the food, they also needed maybe to gravel the road outside, pave the road outside the pantry, or put up signs, or do some advertising that the pantry is open, purchase coolers or fridges or delivery trucks, and maybe pay someone for a driver, because a lot of people were also losing jobs and needing jobs, and pantries had faced difficulty in getting volunteers. So yeah, and the types of food is important. So many pantries did report they were getting a lot of food, but then the pantries also reported they were not always getting the right kind of food. So one pantry was very happy, which was in a residential facility, about how they were getting kid-friendly food, and they hoped that would continue. One pantry director said that there was a shortage of beef in their stock, and that was a high demand item from the clients. Definitely helped with PPE supply, because pantries often did not have money to buy masks and gloves and sanitizers. Some of the pantries did receive that from government agencies, or they received masks from individual donors who sewed it and gave it to them. Food quotas, this is more a retail problem, and not all pantries faced it, but some pantries who didn't really have enough food donations, or their director would have to go and buy food, they faced a lot of problem with food quotas that the grocery stores had imposed. Even though they were, of course, not, they could buy more than a regular client, it was still not enough for like the scope of the work of pantry. Then definitely some issues with the clients. There were a lot of new demographics. Pantry directors or staff did not have enough time to actually sit and like talk to them or understand them, but they still tried their best. Like I won't say understand them, but it's just like connect with them or help them. Luckily, the paperwork or the documentation demand for using pantry was very like, it was like relaxed. So a lot of new clients were able to come in without the hassle of a lot of paperwork. But yeah, so in some cases, there was an immigrant population that came up in some counties where the employment was mostly seasonal. People, the pantry saw an increase in clients. Transportation, now this is like a lot of pantries have clients who probably couldn't drive. And some pantries did provide home delivery. Some of them refused just because they didn't have enough volunteers, or they did not have, or they did not want to expose their volunteers to potentially sick people. In one case that I already mentioned, the local police department was coming and picking food and delivering. In a pantry, there were social workers, like case social workers, who would come and pick food for their clients, and who were also the clients of the pantry. So yeah, and then there were some issues with clients respecting the new procedures. Mostly it was a positive reaction from clients, but there were some instances where clients refused to wear the mask or socially distance or wait outside and not go in and crowd, and they got rude to the staff. So they got rude to the volunteers. So maybe some help in that regard would have helped. And again, it would probably involve a host of other factors, government agencies, maybe the local media stating like you need to be, like local media promoting guidelines on health and safety protocols. So yeah, this research overall does show the response of the emergency food system and how a host of factors influence it, but it also shows how the importance of religious institute and religious people. And this is the Midwest, this is Missouri, so religion is still a pretty important aspect of people's life and an important institution. The church is an important institution, so people do have a trust factor in it. So yeah, and just it shows the trust of the communities in these pantries, and the pantries who tried their best to live up to that expectation or to that, that bond of trust. And it also shows the importance of social capitals, which I've discussed, that it's stronger community networks and ties you have, the more likely you're able to survive and thrive, but you still need government help. And that's also a form of social capital, maybe just a different name for it. So yeah, if these pantries were not operating during the onset of pandemic, many more people would have had a very hard time in accessing food. So it just shows that how important pantries are to our to emergency response systems of food, and how they do facilitate people, and how they are like an essential service, and how they are at the heart of the community. Yeah, that's all. Thank you.